Dr. Hammond, you're the only person here in Cache Valley that does LASIK. Tell me a little bit about that.
That's a really great question. LASIK is simply just a procedure that we do to help people get rid of their glasses. So it's a way that we reshape the cornea to focus the light so they don't have to use glasses to focus the light anymore.
So anyone with glasses from the age of what, 21 to?
21 really to any age. I've done up to 65-year-olds. It really just depends on the health and what they want out of their vision. If they want to get rid of their glasses, then I would say come in and we'll check it out and see if you're a candidate.
And we have some really expensive machines here. In fact, one right behind us was imported from Sweden. Is that what
Switzerland?
Switzerland.
Yes. So this is it's called a Zimmer femtosecond laser, technical name for it, but it is the laser that we use that makes the flap or the corneal flap when we do LASIK. It's an all laser procedure. There are no blades included, and that's the laser.
A lot of people might think that you take a razor blade out.
Exactly.
Chopping
it out and a little sandpaper here or there. No, it's all done with lasers, very precise.
And the other question someone might ask is, how many have you done?
Thousands, well over 6,000 on my own. And then I was the director of warfighter refractive surgery for the Army, and I was involved in, well over 20,000 as the sort of chief of warfighter refractive surgery.
Well, that's impressive. Tell me a little bit about that. Like, what kind of eyes did you do surgery with?
So I was the director for the program in Landstuhl, Germany. I was stationed there as an Army ophthalmologist, and I was in charge of the entire refractive program for Europe. That included pilots, special forces, F-16 pilots, C-130 pilots, and
so those are eyes that you need to be a little more careful with.
Absolutely.
Everyone's eyes.
Exactly. And then my favorite person would be the 11 Bravo, or the infantryman, the guy, the grunt down on the lines. Really a life-saving procedure for those guys.
Exactly. Tell me too, what sets you apart a little bit from maybe the, numbered people that come in, the factory kind of eye specialists?
And we pride ourselves on this. We have not only the best equipment in the world, but we feel like we have the chance to take time with each patient individually. You're only going to work with me while I'm doing the pre-op planning and the surgical planning, and all the exams are done by me. And so I think that sets us apart, that you just really are going to have your surgeon with you the whole time.
You're going to take the quality time with each person.
Correct.
And tell me a little bit about what someone would expect if they got eye surgery.
Good question. So I think we just start from the beginning. They'll come in for a free consultation where we really determine whether it's safe for them to have the surgery. After that, they'll go through a series of exams where we just verify that all the data that we got in the first exam is stable and it's not changing. So a couple of exams, and then at that point, we're ready for the surgery. We plan the surgery date. We have the patient come in, lightly sedate them, make them happy, and do the surgery.
And then after they go home, what's the recovery time? Because a lot of people might think, I'm going to be out for days, so I won't be able to see.
Right. Usually they'll go home a little bit fuzzy, a little blurry, and then within a few hours they're seeing very well. That first afternoon you feel a little scratchy, maybe like there's a piece of dirt in your eye for a few hours, but then by that evening all that's gone, and the next day your vision's nice and clear.
And what do you do exactly? You just kind of cut with...
Great question. So the cornea should be the shape of a basketball cut in half, or a perfect dome. We just make a little flap of eye skin, lift that up, laser, and then put that flap back down. So in a sense, if your cornea is not that perfect shape, we're reshaping it so it is.
Well, that's exciting.
It's really fun to do. It's my favorite thing to do because it's so life-changing.
And what other things do you do here? What else do you offer?
We do all kinds of things, from cataract surgery to little kids exams to just routine eye exams, and advanced procedures like glaucoma.
Glaucoma, and what kind of surgery? Is there any surgeries for that?
Yes.
There is. And you do those kinds of things?
We do those here as well.
And this machine here, I know you have a $1 million room.
Yeah, that's right.
I know.
This machine is it's called the Allegretto Wavelight machine, and this is actually the machine that reshapes the cornea. So we use our femtosecond laser to make the flap, and then this machine is the reshaping machine. It reshapes the cornea so it's the proper shape.
And someone might be a little surprised by how long it takes.
Yes. This machine takes 19 seconds, and this one... 19 seconds to make the flap, and then this machine will take right around 4 to 8 seconds per patient, per eye.
Per eye. So you're basically in here for how long? 40 seconds?
Yeah, exactly. From start to finish in this room, it's probably about 15 minutes just getting everybody ready, but the actual surgery time's about 20 seconds per eye.
That's really impressive.
It's fast.
And where are you located if somebody wants to come and come down here for a free consultation?
120 West Cache Valley Boulevard, which is a little hard to find because it's Cache Valley Boulevard, but it's really easy. It's 1250 North. Just turn right at the Sizzler. Yeah. Right at that light.
And there's Bingham.
A couple blocks, Bingham Plaza. We're on the ground floor.
Right across from Sam's Club.
Exactly.
Easy to find. Well, what's your phone number too?
435-787-7200.
And the only person here in Cache Valley that does the LASIK.
That's correct.
So you don't have to go to Salt Lake anymore if you want LASIK.
You can come right here. We've got the best equipment in the world.
And Dr. Hammond,
thank you
so much.
Thanks.